Hi everyone, it's Dr. Krad. Lens implants are delivered in packaging that displays the lens implant's type and power. If it's a monofocal lens, if it's a multifocal lens, or a toric lens for astigmatism, the packaging will say so. But can a lens implant be packaged in the wrong box? In the 13 years that I've been in practice, I've never seen that before. But that's what seemed to happen in this case. I ordered the Aspire monofocal lens for this patient. We verified the lens implant prior to surgery with our timeout, but upon insertion, I immediately noticed the toric lens markings on the lens implant. I asked the circulating nurse to bring the correct lens implant, but also to bring the box or the packaging from the first lens implant that she opened so that it could be checked. Here, I'm about to remove the toric lens implant, but prior to doing so, I'm going to insert the correct lens implant in the capsular bag. This will serve as a scaffold and protect the posterior capsule as I cut out the toric lens. Then I'll grasp the toric lens with MST IOL graspers, cut it in half, and then remove each segment out of the eye. Meanwhile, the circulating nurse says she can't find the box of the lens implant she had just opened. She literally just opened it a few minutes ago and says she couldn't find it. Usually by this point, the open box would have been disregarded in the waste bin in the OR, so like right on top of the trash bin. How could it be lost? It should be right on top, but it's not there, and it's not on the table, it's not on the desk, can't be found. It's really weird. At the end of the case, I even went inside the trash bin, was digging around, and I couldn't find it. It couldn't have just disappeared. And the nurse swears she opened the correct box and put it in the trash bin. It didn't feel right, but perhaps there was a packaging error that needed to be reported to Bausch & Lomb. Well, a month later, I found out exactly what happened. I was operating on another patient and they were scheduled for a toric lens implant. But when I called for the lens, the nurse said, "The box is empty." Empty? What? What do you mean empty? But she was right, the box was empty. Thinking back to the unusual case the month before, where a toric lens was put in a spherical box, I checked the power of both lens implants for both cases and they matched. The nurse in the first case incorrectly opened the toric lens box, then closed it and put it back with the surgery center's inventory of new lenses. I don't understand. Clearly she was flustered. In any case, thank goodness we had a backup lens available for the patient. In fact, most surgeons and surgery centers will have at least one backup lens implant for each patient. Most people in healthcare and perhaps other professions noticed a very high rate of staff turnover over recent years. As soon as someone new is trained, they're gone and they're replaced by someone else that's new that needs training. And although our nurse was super nice, she was new to our surgery center. But ultimately, it's on the surgeon to make sure that each patient does well, not the nurse. We are all human, and as the surgeon, we need to be diligent and pay attention to every step. In an ideal world, I would work with one elite team at one elite surgery center. But the reality is, if one takes a lot of insurances, PPOs, HMOs, Medicare, Medicaid, they are each contracted with different surgery centers. And so the insurance requires the surgeon to perform the surgery at the insurance's contracted surgery center. I'll tell you a crazy story. I once met with a health insurance executive, and I told him that the surgery center that his plan is contracted with is old and out of date. I asked him if we could have the option to also take those patients to another surgery center. Not only was the surgery center newer, it was better equipped, and they would charge the health insurance less. So it was a win for everybody. It was a win for the patient, a win for the surgeon because they would enjoy operating there more, and it would be a win for the health insurance company because they would pay less. But you'll never guess what he told me. He said, "We're not paying more now because we're paying ourselves." That's the sad truth. Many health insurance companies have financial relationships with facilities that perform medical procedures. To work at one center only, I would have to drop so many patients and so many insurances. So I end up working with different teams at different centers with different equipment all the time. And these teams are changing regularly. They say a team is only as good as its weakest link. Conversely, a team could be elevated by the strongest team member. So one could argue that a team is only as weak as its strongest team member. To try and prevent the error that we had from happening again, we educated our staff about the differences between different lenses like toric and monofocal, and we showed them the difference in the packaging and where to look and what's important. And we reviewed best practices, such as never walking in and out of the OR carrying someone else's lens implant. No lens should ever be in the OR that is not intended for the current patient. Don't worry about getting the next patient's lens implant ready until we are done with our current case. And for anyone starting a new job, maybe they're nervous, they're trying to be quick, but it's better to be slow and precise rather than quick and sloppy. Know that with time, experience and good habits will make you more efficient. And never be shy to talk to the team and tell them, hey, I think we're going too fast. I'm afraid I'm going to make a mistake. Overall, being precise will save the team time. I hope you found this video helpful. Thank you so much for watching. I'll catch you on the next one. Peace.